So after viral classification, we have to point out some important buzzwords or important clues and important data from the respective discussions of different classifications of the different classes of the viruses. So first one, we discuss the par para Microviruses. As we have known that Paramyxovirus is a negative stranded virus, because we have the mnemonic that always bring polymerase or fail replication, so in which there is the P part is Paramyxovirus, and they need RNA dependent RNA polymerase for replication. They are negative stranded single stranded viruses, and also the examples is M for measles and mumps, P for Parainfluenza, and R for respiratory syncytial virus. And these all viruses are they are the CPR on hippie, so they are enveloped viruses, and in their enveloped lipid biomembrane they have a fusion F protein, against which we have monoclonal antibodies, and this fusion proteins goes into the host cell, especially the respiratory epithelial cell, and fuses to form syncytia and causes multinucleated giant cells and cause different diseases, especially the respiratory syncytial virus do this. And we have a mnemonic over there that this monoclonal antibody Paranizumab for Paramyxo, especially the respiratory syncytial viruses, in the prophylaxis of the prematures or primates. So this is general information regarding the Paramyxoviruses. So the first one is very much important, is the rubiola or measles. So in measles we have first the prodromal fever. In the prodromal fever we have the 4 C's. The first one is cough, second one is coryza, third one is conjunctivitis, and the fourth one is Koplik spots on the buccal mucosa. Unlike the Forsyth spot of in the rubella virus, so Koplik spots on the buccal mucosa. So after this spot appears, following the 1 or 2 days following these Koplik spots, we have found 1 or 2 days we have found the rashes, the maculopapular rashes, and these appear first on the head and then on the body. And after few days of these rashes, if untreated, then it can cause encephalitis, 1 in 2,000, and years later, if you not treat that, then it can cause subacute sclerosing panencephalitis, complete involvement of the brain and with sclerosing. So in this we have the personality changes, we have dementia, and also dementia, personality changes, and then we have ANS abnormalities, autonomic nervous system abnormalities, and the antibodies which are involved in the anti-measles uh, fighting against the measles virus. They accumulate and form oligoclonal bands in the CSF. So, uh, if the child or if that person is immunocompromised, immunosuppressed, or immunosuppressed, then it can cause giant cell pneumonia. And giant cell pneumonia is the most common cause of measles related death in children. So, vitamin A supplementation is very much important. Vitamin A supplementation is very much important, especially if the child is malnourished. And it's a vitamin A supplementation also decreases the mortality rate of measles. So this is all about the general information about measles. Then we have the mumps. Mumps is pretty easy because we have three mnemonic: pom, pom, pom. So P for it affects the parotiditis, parotiditis. O for orchitis, inflammation of the testicles. M for it can affect uh, M for it can affect meninges, meningitis, and P for it can affect the pancreas, pancreatitis. So this is just because mumps is very much subside due to the recommendation of MMR, effectiveness of MMR, measles, mumps, rubella virus vaccination. Then we have the CRU or Parainfluenza. Parainfluenza, and in Parainfluenza there is a barking, seal-like barking cough, and seal-like barking cough with inflammation of the respiratory inflammation of the soft tissue in the pharynx, and which can cause inspiratory stridor and also steeple sign due to the narrowing of the airway, steeple sign on the x-ray. And if this group is severe, untreated, and it is very much severe, then it can cause pulsus paradoxus secondary to this group paradoxus. So there is a the parainfluenza virus also have the hemagglutinin and neuroimmunidase as enzymes on their in their envelope, lipid bilayer cell wall. So the vaccinations are very much effective, and the antivirals are very much effective for CRU. So there is a little mistake, listed little information regarding measles, rubiola. There is a lymph adenitis, inflammation of the lymph nodes. So when this virus attack the lymph nodes, it's a virus, it can cause paracortical hyperplasia. Then it can cause a fused lymphocytes or giant cell known as Warthin Cadley giant cell. So this is just uh, a little information regarding paramyxovirus. So this is all about paramyxovirus. We have discussed rubiola, parainfluenza, mumps, and measles, and respiratory syncytial viruses, and different aspects of uh, paramyxoviruses.